Hello, my name is Jackson Barron. Today we're going to be talking about the muscles of the medial thigh and hamstring. Up first, we've got the gracilis muscle. This is the most superficial muscle of the medial or adductor compartment of the thigh and is innervated by the obturator nerve, which is a branch of the lumbar plexus. The gracilis is a long, thin, flat muscle that starts out broad at its origins on the anterior body and inferior ramus of the pubis. The muscle's fibers taper off as they travel inferiorly, ultimately blending into a round tendon which inserts on the superior medial surface of the proximal tibia. The gracilis acts on the hip and knee joints, resulting in several movements, including weak thigh adduction at the hip joint, aiding other more powerful thigh adductors. It is also a strong contributor to flexion of the knee, as well as medial rotation around the knee joint when it is in a semi-flexed position. The most important function of the gracilis is aiding the hamstring muscles in flexion of the knee during the initial swing phase in walking. It also plays a key role in horseback riding. Up next, we have the pectineus muscle. Pectineus is a short, quadrangular muscle innervated by the femoral nerve. It has the most superior attachment of all the thigh adductors, originating from the pectineal line of the pubis. The muscle then courses posterolaterally down the thigh, where it inserts into the posterior surface of the femur along the pectineal line. Due to the course of its fibers, the pectineus is capable of multiple actions. This includes flexion of the hip, adduction of the hip, and medial rotation of the hip. In concert with other pelvic muscles, the pectineus' contribution, hip flexion, enables the carry-through phase of the gait cycle. Attaching between the pelvis and the proximal femur, it also acts as an adaptable ligament of the hip joint, stabilizing the pelvis during body movement. Up next, we're going to talk about the adductor longus muscle. This is a large fan-shaped muscle that forms the floor of the femoral triangle. It is innervated by the anterior division of the obturator nerve, originates from the anterior surface of the body of the pubis, and inserts into the middle third of the medial lip of the linea aspera. The adductor brevis has a very similar function. It is a flat triangular muscle, also innervated by the obturator. It originates from the lateral surface of the inferior pubic ramus. From there, the muscle widens into a triangular shape as it runs inferior-laterally towards its insertion on the medial lip on the linea aspera of the femur. The actions of this muscle include hip adduction and flexion. Next, we're going to talk about the adductor magnus. This is the largest and strongest muscle of the medial compartment of the thigh. It is triangular in shape and consists of two parts that each have a distinct nerve supply and action. Like other muscles in the medial compartment, the adductor part is innervated by the posterior division of the obturator nerve. This part originates from the ischial ramus and passes obliquely to insert at the medial lip of the linea aspera. The hamstring part, sometimes considered part of the hamstring group of muscles due to their shared innervation by the tibial component of the sciatic nerve, originates from the ischial tuberosity and descends towards the lower end of the thigh. It ends in a round tendon and inserts at the adductor tubercle on the medial femoral condyle. Both parts of the adductor magnus muscle are responsible for adduction of the hips. The adductor part also contributes to flexion of the thigh, while the hamstring part contributes with the hamstring group of muscles to aid in extension of the thigh. The obturator externus is a small triangular muscle innervated by the posterior branch of the obturator nerve. It has a broad attachment at its origin on the margins of the obturator foramen. The fibers of the muscle converge into a single tendon, which travels in a groove on the inferior aspect of the acetabellum, inserting on the trochanteric fossa of the femur. The obturator externus has two primary functions: stabilization of the femur in the acetabellum, and lateral rotation of the femur when the hip is extended. This is especially useful in climbing. It also plays an important role in walking, counteracting the medial rotation caused by the anterior adductors of the thigh, and together with the other short muscles around the hip, contributes to pelvic stability. The posterior muscles of the thigh are commonly referred to as the hamstring and are composed of the biceps femoris, semimembranosus, and semitendinous muscles. As they cross both the hip and knee joints, they are responsible for multiple actions, including extension of the thigh, flexion of the knee, and while the semitendinous and semimembranous muscles are responsible for medial rotation of the knee, the biceps femoris contributes to lateral knee rotation. The biceps femoris is the largest muscle of the posterior thigh, and it consists of two heads. A long head, which receives its innervation from the tibial division of the sciatic nerve and originates from the ischial tuberosity, and a short head, which is innervated by the common fibular division of the sciatic nerve and originates distally from the long head at the lateral lip of the linea aspera. The muscle fibers from the short head join the aponeurotic sheet of the long head, forming the round common tendon that inserts at the head of the fibula. Just prior to insertion, however, the tendon splits into two slips, passing on either side of the fibular collateral ligament. The semimembranosus muscle is a relatively long muscle spanning the full length of the thigh, from hip to knee. It is innervated by the tibial division of the sciatic nerve and originates from a small facet on the superior lateral surface of the ischial tuberosity. The tendon of the seminosus arises at the level of the mid-thigh and continues towards its insertion at the medial condyle of the tibia. The semitendinosus, as with most muscles of the posterior thigh, is innervated by the tibial part of the sciatic nerve. It shares an origin with the long head of the biceps femoris arising from the ischial tuberosity. It then descends around the midline of the thigh, giving rise to a cord-like tendon that blends with the tendons of the gracilis and sartorius muscles, inserting onto the medial condyle of the tibia. The tendons of the gracilis and semitendinosus are often harvested and used as ligaments for the reconstruction of torn tendons and ligaments throughout the body. In the animation shown, these tendons will be used to repair a torn ACL or anterocruciate ligament. The two tendons are threaded together. The knee is expanded, and the damaged anterior cruciate ligament is removed. Holes are drilled through the tibia and femur to which the graft will be passed. The graft is positioned and secured using screws and staples. And while studies have shown that removal of these tendons weakens the isometric contraction and flexion of the knee, this does not severely impact a patient's quality of life, and in over 70% of patients, the tendons grow back within 1 year.